Okay, first of all, where we can look at this is look at the Erector Spinae. The Erector Spinae basically travel around down the length of the spine. They working from lateral to medial. Laterally we have longissimus. Medial, a little bit more medial to that is iliocostalis. Medial to that is spinalis, and underneath them we have the multifidi. Now, bear in mind that these muscles kind of overlap each other, and so the trigger points often will be difficult to differentiate between the two types of or the different types of trigger points where they are. For example, when we're looking at longissimus and iliocostalis, or the Erector Spinae generally, their referral patterns could be in a number of places underneath the scapula for trigger points further up, which we're not actually talking about now, or actually along the spine and up towards the scapula, or even down by the iliac crest. So using the tools in conjunction with your therapist's advice, you can actually find these trigger points. The multifidi are basically attached to the mammillary process, which is just where the facet joint is here, and then go up either 1, 2 or 3 vertebrae above, mainly proprioceptive muscles. Their function will be to kind of tell the spine where it's sitting in with regard to space. So they are quite prone, because of the amount of muscle spindles, they're quite prone to trigger points. But to get to them, we can't really go in as we would for a trigger point along the Erector Spinae. If we look along the Erector Spinae, the trigger points can be along them at different points, closer to the spine or even a little bit out. But you'll learn to locate those with your therapist. However, if you look at the diagrams, you can see the trigger points in the Erector Spinae, but the multifidi are deep to the longissimus and iliocostalis, or the Erector Spinae, so we need to get into them from an angle. So we can do that using some of the tools like the back knobber. The back knobber, if you'd like to just hold that, your back knobber there, and then you will pull the back knobber in. You need to try and get the actual point of the back knobber onto the muscle. When you feel where it is, be careful you're not on the spinous process, because it will hurt. And you just pull in and hold for 10 to 60 seconds, depending on what you've been prescribed by your therapist. If you want to go into the multifidi, we need to do it more at an angle, so you're pulling down in this direction to get kind of behind them, but onto the multifidi. So you would lift your hand up a little bit more onto the, and push down, and hold that for 10 to 15 seconds. A similar sort of treatment can be done for Quadratus Lumborum. If you bring the back knobber down onto one of the trigger points in Quadratus Lumborum, just below the ribs, and you can pull inwards and hold again. Another way of treating these is to lie on your back and use the jack knobber, and just place the jack knobber, turn over, put the jack knobber and find the trigger point on your spine. Now be careful, come down a little bit because you might be on your rib there. Come onto the trigger point where it's uncomfortable and just lie onto it. And you can use that on a normal bed as well. We can see here the jack knobber will be pushing on one of the muscles, and if you want to get into multifidus, we need to just turn it a little bit more of an angle and go in like that. You can also be used at Quadratus Lumborum in those positions as well.